Hi again, we've got another video today. I'm going to go over bleaching today. So the options for making your teeth whiter, this is one of the best options because, or lighter, if your teeth are a bit yellow, you're not quite happy about the colour of your teeth, then this is an option. In terms of making them look brighter and whiter, there's a few things you have to understand about bleaching. Bleaching will only whiten natural teeth. Crowns or fillings, white fillings or crowns, it will not bleach. If you have a white filling, it may lighten the edge around them if there's a bit of staining around the filling, white filling, but a white filling is white filling. So you have different shades and grades of, shades of white filling. You've got A1 that's really white, B1 that's really light. So A1's the lightest kind of yellowy shade, and A2 and A3, most people are A2, A3. So that's a kind of off-white kind of yellow. So you can't bleach white fillings, you can't bleach crowns. So if you have those kind of things and you want to do bleaching and you whiten your teeth will become whiter, and those crowns and fillings remain the same. That means if you really want it all to match, you're going to have to replace the crown and the fillings. So if the fillings are sound and the crowns are sound, there's no issues with them. You're going to be drilling down teeth and drilling things to make them match whiter teeth, which may not be a great idea because every time you drill a tooth, you don't know what's going to happen, and it could get quite pricey. If your teeth are naturally just white, your front teeth, not the back teeth, but your front teeth, the outer surfaces of your teeth that people are going to see, then you can bleach your teeth. Don't matter if you've got silver fillings at the back or white fillings at the back or white fillings on the inner surface of your teeth. On the back of your teeth, where the roof of your mouth against the palate, or your tongue face the tongue inside of your mouth, that's not going to be visible. It's the outside surface of your teeth you want to lighten when you're bleaching. And bleaching is reversible, so if you decide you don't like it, you haven't drilled your teeth, you haven't altered the shape, so that's a good thing. In terms of costing, if you're going to do things like crown and veneer, which I strongly advise against drilling your teeth down, unless your teeth are in a really bad state already, advise against drilling your teeth down, aka things like turkey teeth and all these things you hear about, even in the UK doing things here, or in places where maybe they would more costly, and maybe they're doing very well. You're still drilling your teeth down. You can't put them back if you don't like the way they look. So that's it. They can do things like mock-ups or wax-ups of the way the teeth would look. So they put them on a model, how they'd be, and the lab would kind of wax it up and show you what they'd look like if you've had the particular veneers or crowns done. But still, you're altering shape, and the more you do your teeth, the less likely you're going to last. So bleaching, the things you have to understand bleaching is when you bleach, your teeth can become sensitive and the gums can become sore, and that's why you're doing it. The other thing you have to understand, most bleaching systems suggest you'll get up to B1, which is one of the lightest shades going. So I'll show you what B1 is. Let me get a thing out. So most people, this is a shade guide, Vita shade guide. Yep, and this is it just different shades of teeth. This is how much shades for crowns, just specifically for crowns. And most people are this kind of shade, if you can see that. This one, A3. And then you can get, they say, up to this shade, which is B1. Yeah, A3 to B1. That's what they say. Not only, everyone's teeth, like to bet. So that's the kind of shade you can get, that kind of shade. Yeah. I'm not sure what that's showing. Okay, that's what they claim, but a lot of times, sometimes you can get from that to that A1, which obviously, and this is what most people's shades are like. This is what most people are like. This is A3, or sometimes it'd be a more thing. So what you need to do, understand that your teeth may not always brighten as well as you want, up to your hopes and expectations. That's what I tell patients. B1's the ones that they suggest that they can get for you, most of these bleaching systems. And it's reversible. So you have to do, with these bleaching systems, we don't do it in the chair. It's more pricey. You do when you take molds of your top and bottom teeth, send them to the lab, they make your trays, you put the bleaching agent in the trays, and you wear those trays and put the bleaching agent in the trays, the bleaching stuff, the bleach. Other thing you have to understand, more bulky teeth like the canine, your fang teeth, your pointy fang teeth, your vampire teeth, they've got more bulk of dentine. Dentine gives you the colour of the shade of your teeth, the yellow stuff under. The outer layer enamel is what makes your teeth lighter. And because they're more bulky, the canine teeth, they show more yellowy. So you may have to consider doing the canine teeth a bit more than the other teeth. The flatter teeth, the front ones, your front two teeth the incisors, the flat ones, top and bottom, will bleach quicker and easier because they're lighter. While you're bleaching, because everything's opened up and exposed, you're removing the stain, but then you have to avoid colourful foods. Beetroot, red wine, curry sauces, pasta sauces, things like that. Smoking's probably not a good idea maybe as well. Those kind of things, coffee, black coffee, maybe tea. You want to avoid the colourful things, have very bland foods. And also Sensodyne can help because your teeth can become sensitive to Sensodyne. If your gums become sore, then you can take painkillers, or you can, if it becomes very sensitive sore, you can leave it off it a day or two. Generally a couple of hours a day. You can wear them all night if you want to sleep with them in. That will give you a lot of lightening. However, you'd have to understand it can cause sensitivity. So a couple of hours a night should be okay. And you're looking at a good few weeks to do it. We normally give 3 syringes, top 3 for the bottom, which is more than enough. You do have to top up. So every kind of, depends how much your teeth pick up stain, or you do have to top them up. The other thing you need to do is make sure you're brushing and flossing well. So when you brush and floss well, you get the soft deposits around your teeth and bits of food. If those bits are in the way, when you put the bleach on your teeth, it won't get to the area that needs it. There'll be a barrier. So in the best possible route to most bang for your buck for each application of bleach, make sure your teeth are spotlessly clean. You can use Sensodyne. I'd advise you in Sensodyne, your teeth can get sensitive. The other thing is you want to keep your trays really safe. So don't keep them anywhere where they can get any moist areas. Once you've used them in the morning, you take them out, give them a wash, give them a rinse. Something like some bit of hand soap would be fine. Nothing too abrasive. Don't use toothpaste. Don't brush them. Be quite gentle with them. Rinse them out. Dry some tissues and keep them somewhere safe where they can remain dry and air, because you don't want them to get mouldy, because you have to pay for more trays and they're expensive. It's a lab bill, big lab bill with these trays. So you want to keep it tray safe. You want to just be careful, not bend them, flex them, mess with them. So this is what a bleaching trays are like. This is for lower teeth. It's on a model at the moment, so I'm just going to pull that off. And this is this is from another place from before. These are a bit flimsy. The ones we've got are more like gum shields, a bit more solid. But what you do is you put a bit of bleaching agent in the front of each one of the spots. So here's some stuff we use. Boutique whitening is quite good. It's 16% carbamide peroxide, which is the best level. Safe level. And what you want to do is you get the syringes out. Let me show you, demonstrate how you do it. You dip that clip on it at the end. You want to break that off. You're not going to break it off. Keep it in the fridge as well. I need to keep these in the fridge. And what you're going to do is squirt a little into the front, a little spot into the front of each one, not the back, not the biting surface, just the front, and you wear them. When you put them on your teeth, for example, you put your teeth on there and you get any bits coming out, you just wipe it with a clean finger or like a tissue or something, so because you don't want to irritate the gums. If you've got a lot that's come out, you put too much on and you're wasting it. You're going to irritate the gums, you're wasting it. So don't put too much on. You basically do that. Normally the dentist would take a shave before, so if you were A3, he'd show you and document in the notes, and then he'd show you the difference. So hopefully it would be after a couple of weeks doing something like this. If you have any problems with it, obviously you go back to the dentist. If they're sensitive, use Sensodyne. If you're really sensitive, you want to come off it for a day or so. But I would generally say you want to continually do it each and every single day to get the best possible results and not use too much. You should have some left over from the 6 syringes we use, 3 for the top, 3 for the bottom, and you can just top it up. So it will fade a bit. As I say, if you've got a special occasion, you can just do it for a couple of days before, and it will come back quickly and brighter and whiter. So these are syringes just showing you. And it's the most reversible, best thing to do to make your teeth whiter and brighter. It would be maybe advisable before you start the bleaching to have a bit of a cleaning and a polish. Normally we do a clean and a polish, so all the build up and hard build up and soft stuff's off, and the patient state starts straight away. Majority of people are happy. I always warn people, you may not get your hopes and expectations, what you want, but most people are happy with what they get, and it's reversible, and you haven't crowned your teeth, you haven't capped them, you haven't veneered, which I advise against. If you don't like the position of your teeth, the position, get braces to straighten them. If your teeth are really, say your teeth are full of fillings and loads of fillings over the years, your front teeth, and they look bad, and you want to make sense, you could do that. But if your teeth are naturally okay and they're not in the right position, get braces done. And if then after that, if you don't like the colour, get bleaching done. It's totally reversible. You haven't altered the shape, you haven't drilled your teeth, you haven't damaged your teeth. That's what I'd advise. This system works pretty good. You can do the in-chair stuff. We don't do that stuff here at this practice. I don't do that kind of stuff here. It works good. This works good for most people. Most people are happy. Keep the trays safe. Keep the trays safe, whatever you do. And you can buy more syringes. If you need more, you can top it up. It's no way expensive. They're no more expensive. You just buy the syringes when you need it. But like I said, use it minimally, use it sparingly, and that's what I'd say really. Bleaching is one of the best ways of lightening your teeth, and you're not done anything to the teeth, you're not damaged teeth, you're not drilled the teeth, you're not done anything that could give you problems in the future. The only thing you get with this sensitivity, and the gums can be a bit better. So sensitivity, the gums are a bit sore. Sometimes you can get white patches on the teeth because the teeth get dehydrated. And it's got demineralizers, use some of the mineral content from the tooth. But when you stop doing and when you stop bleaching, then that will get better. And also, what you want to do to prevent that is make sure you're brushing well, make sure you avoid anything acidic, and also keep your fluid levels up. So obviously not colourful drinks. You shouldn't have colourful drinks while you're doing bleaching. Just drink plenty of water, and that will help with that. Majority of people that do it, they're like getting married. I'm getting married. I want to just whiten my teeth. I just want to whiten the teeth. Most people are happy and content with what they do, and they do top up. So they buy syringes from time to time, and that's it. So it works pretty good. The other thing I would say is, if you're not happy with the colour of your teeth, because staining is about brushing and flossing well. Electric toothbrush work good. If you use manual one, change your brush every 2 to 3 months. If the bristles become splayed or spread out, then change it sooner than that. Everyone's different, whether it's electric toothbrush or manual brush. Electric toothbrush is really good and very effective. Brushing and flossing helps a lot, and regular cleanings help a lot. So if you go to dentist regularly, you floss every day, you're brushing well, you may not need bleaching, maybe just staining on your teeth. So if you do that, that can help as well. But if you want to do bleaching, speak to your dentist about it and see what they think. Try not to do things with your teeth that will alter the shape. Try not to do things with teeth that involve drilling them down. If you want your teeth to last as long as possible, you want to do bare minimum, just prevention. Keep sugary things manual, brush and floss, use good quality fluoride, have regular cleanings. That's a big thing. Regular cleanings to prevent gum disease. And if you need treatment, get it done. Have regular checkups, regular x-rays. That's the main thing. Go regular. Don't just go when you have pain. And this will help you to maintain teeth good and keep a nice smile. Anyway, that's a video for today. Hopefully we'll do something. I'm not sure what to do. If you've got any suggestions of what you want to go over, any questions, queries, just let me know. Okay, see you next time. Bye-bye.